Welcome to another practice question video. At the end of the video, sign up for free daily practice questions and free bonus nursing printables. Now let's begin. Starting with question 1. The nurse notes variable decelerations on the fetal monitor strip. The most appropriate initial action would be to notify her doctor. Start in 4. Reposition the client. Readjust the monitor. The correct answer is reposition the client. The initial action by the nurse observing a late deceleration should turn the client to the side, preferably the left side. Administering oxygen is also indicated. Initial management of recurrent variable decelerations should have a target of relieving potential cord compression. As the client reaches 8 cm dilation, the nurse notes late decelerations on the fetal monitor. The FHR baseline is 165 to 175 bpm with variability of 0 to 2 bpm. What is the most likely explanation of this pattern? The baby is asleep. The umbilical cord is compressed. There is a vagal response. There is uteroplacental insufficiency. The correct answer is there is uteroplacental insufficiency. This information indicates a late deceleration. This type of deceleration is caused by uteroplacental lack of oxygen. Late decelerations are one of the precarious decelerations among the 3 types of fetal heart rate decelerations during labor. They are caused by decreased blood flow to the placenta and can signify an impending fetal acidemia. Which of the following is a characteristic of a reassuring fetal heart rate pattern? A fetal heart rate of 170 to 180 bpm. A baseline variability of 25 to 35 bpm. Ominous periodic changes. Acceleration of FHR with fetal movements. The correct answer is acceleration of FHR with fetal movements. Accelerations with movement are normal. Accelerations are transient increases in the FHR. They are usually associated with fetal movement, vaginal examinations, uterine contractions, umbilical vein compression, fetal scalp stimulation, or even external acoustic stimulation. The presence of accelerations is considered a reassuring sign of fetal well-being. The rationale for inserting a French catheter every hour for the client with epidural anesthesia is the bladder fills more rapidly because of the medication used for the epidural. Her level of consciousness is such that she is in a trance-like state. The sensation of the bladder filling is diminished or lost. She is embarrassed to ask for the bedpan that frequently. The correct answer is the sensation of the bladder filling is diminished or lost. Epidural anesthesia decreases the urge to void and sensation of a full bladder. A full bladder will decrease the progression of labor. Under the influence of epidural analgesia, patients may not feel the urge to urinate, which can result in urinary retention and bladder overdistension. A client in the family planning clinic asks the nurse about the most likely time for her to conceive. The nurse explains that conception is most likely to occur when estrogen levels are low, luteinizing hormone is high, the endometrial lining is thin, the progesterone level is low. The correct answer is luteinizing hormone is high. Luteinizing hormone released by the pituitary is responsible for ovulation. At about day 14, the continued increase in estrogen stimulates the release of luteinizing hormone from the anterior pituitary. The LH surge is responsible for ovulation, or the release of the dominant follicle in preparation for conception, which occurs within the next 10 to 12 hours after the LH levels peak. A client tells the nurse that she plans to use the rhythm method of birth control. The nurse is aware that the success of the rhythm method depends on the age of the client, frequency of intercourse, regularity of the menses, range of the client's temperature. The correct answer is regularity of the menses. The success of the rhythm method of birth control is dependent on the client's menses being regular. Women are only fertile, an egg is present, for a few days each month. A client with diabetes asks the nurse for advice regarding methods of birth control. Which method of birth control is most suitable for the client with diabetes? Intrauterine device. Oral contraceptives. Diaphragm. Contraceptive sponge. The correct answer is diaphragm. The best method of birth control for the client with diabetes is the diaphragm. The diaphragm is a birth control, contraceptive, device that prevents sperm from entering the uterus. The diaphragm is a small, reusable rubber or silicone cup with a flexible rim that covers the cervix. The doctor suspects that the client has an ectopic pregnancy. Which symptom is consistent with a diagnosis of ectopic pregnancy? Painless vaginal bleeding. Abdominal cramping. Throbbing pain in the upper quadrant. Sudden, stabbing pain in the lower quadrant. The correct answer is sudden, stabbing pain in the lower quadrant. The signs of an ectopic pregnancy are vague until the fallopian tube ruptures. The client will complain of sudden, stabbing pain in the lower quadrant that radiates down the leg or up into the chest. Patients presenting with vaginal bleeding would likely benefit from a pelvic exam to assess for infections as well as assess the cervical OS. The nurse is teaching a pregnant client about nutritional needs during pregnancy. Which menu selection will best meet the nutritional needs of the pregnant client? Hamburger patty, green beans, French fries, and iced tea. Roast beef sandwich, potato chips, baked beans, and cola. Baked chicken, fruit cup, potato salad, coleslaw, yogurt, and iced tea. Fish sandwich, gelatin with fruit, and coffee. The correct answer is baked chicken, fruit cup, potato salad, coleslaw, yogurt, and iced tea. All of the choices are tasty, but the pregnant client needs a diet that is balanced and has increased amounts of calcium. This food item contains meat, fruit, potato salad, and yogurt, which has about 360 milligrams of calcium. To maintain a healthy pregnancy, approximately 300 extra calories are needed each day. The client with hyperemesis gravidarum is at risk for developing respiratory alkalosis without dehydration, metabolic acidosis with dehydration, respiratory acidosis without dehydration, metabolic alkalosis with dehydration. The correct answer is metabolic acidosis with dehydration. The client with hyperemesis has persistent nausea and vomiting. With vomiting comes dehydration. When the client is dehydrated, she will have metabolic acidosis. In severe cases of hyperemesis, complications include vitamin deficiency, dehydration, and malnutrition, if not treated appropriately. Wernicke's encephalopathy, caused by vitamin B1 deficiency, can lead to death and permanent disability if it goes untreated. Well, that's it with this video. See you next week for another set of questions. Leave a comment saying how many you got correct.